My name is Erica Saylor. I'm a research associate with the Douglas W. Pollock Center for Addiction Outreach and Research at Penn State Harrisburg, and I'm really pleased to be able to MC our webinar today for the Life Unites Us campaign, Pandemic Paradigms, Providing Services Throughout the Holiday Season. I just want to welcome everybody, and I appreciate everyone's patience with some of the technical issues this morning, so hopefully moving forward it'll be smooth sailing. So today we're just going to start with a few housekeeping items, an overview of the Life Unites Us campaign, and then we'll get right into the moderator introduction and the panel, and there'll be time for questions, and we'll wrap up. So just a few housekeeping items for everybody. We will be doing a few Zoom polls today, so when we push those out, just keep an eye out for those. If you have any questions for our panelists, for anybody speaking, please put them in the Q&A feature and not the chat feature. With the Q&A feature, we can kind of answer them in order, and it just works a little bit easier for us to be able to answer all your questions. If you get disconnected from Zoom, please retry the original link. If you have any issues, please feel free to email me directly, and I'll try my best to get you back in. Alrighty, and I'm going to turn it over to Maddie to start us off with some campaign information. Maddie?
Thanks, Erica. Good afternoon, everyone. Thank you for being here. Happy Tuesday, happy holidays. Hope you're all doing well out there. But my name is Maddie, and I am the Collective Impact Coordinator on this campaign. So my whole role in this effort is to figure out how we can connect this campaign with partner organizations like so many of you on the call today. So that being said, I'd love to learn a little bit more about who's here. So Erica, if you wanted to help present the first question in the poll, I would just love to get to know you a little bit by knowing what region you primarily work within. And then the second question, once you've done that one, is which best describes your organization, kind of what type of organizations are on the line today. Would love to hear from you. So we'll give you a moment to complete that one. And Erica, are you able to put up that second question about what best describes your organization?
Yes, give me 1 second here.
Yeah, all good.
I'll just share the results of the organization one real quick, just so everybody can see. Looks like we have a pretty even breakdown.
Great, South Central pulling ahead, but everyone else, welcome. I'm glad to see we have representation from all parts of the state.
All right, second poll just launched.
Thanks, Erica. And also feel free to say a hello from wherever you are on the chat. We'd love to see what organizations are here and who's on the line. So thank you all very much. Well, with that, for those of you who are new to the Life Unites Us campaign, I just wanted to share a couple quick notes about what the campaign is and kind of why we're here today. So the goal of the campaign is to reduce stigma around opioid use disorder. And we do this, our approach here is what we call a people forward approach. So through our own research and practice in anti-stigma work, we have found that connecting people through stories and similarities can and will reduce stigma. So in order for us to actually do this, our team records stories of community members across Pennsylvania, stories of both personal recovery and stories of those who are allies to someone in recovery. We then produce those stories and put these videos up on our website and our social media to be shared far and wide. And our intent here is that by sharing stories of hope and resiliency, we can prove that those living with an opioid use disorder are so much more than just their disease. But however, as powerful as this research is and kind of as strong as this idea is, we know this campaign will not be successful without community partners like all of you engaging in this effort, helping us to spread the word and getting your communities involved. You know your communities much better than I do, and we are looking for partners in this campaign in lots of different ways. So our whole aim for this project is to uplift the work that you're doing and create another tool for you to add to your tool belt, your toolkit, to just support the work you're already doing. So partners on this campaign, Erica, you can flip to the next slide if you don't mind. But partners on the campaign have the opportunity to help us both recruit stories and then share them with your communities. So if you're interested in being a partner, we can put your logo on our website, and we love seeing all the organizations that are working with us and want to share the hard work that you're doing. We can send you curated campaign videos and content that we think might work well for your community. We'll ask for your input on these trainings that are happening here today and future content and sort of direction of the campaign. And then we'll also make sure you have access to all of our partner resources. So if you're interested in becoming a partner, you can email me at Madeline, my email's up there. If you can see the screen, that's my email. That's easier than me spelling it out. You can also go to the website, and there's a link all the way at the bottom that says become a partner. If you just fill out that little form, we will be in touch with you. So I think I saw the last Zoom poll or whatever we're calling these things, the poll question pop up on the screen, which is which platform is most successful for communicating with your community. So we want to know, how can we make this easy for you to share with your community? Is it via Facebook, Instagram, Twitter? So if that poll is still around, we can maybe relaunch it or something, or you can just let us know in the chat. Oh, there it is. Amazing. Thank you. Yeah, let us know. And I'll just give you all a second to type that in. And please be in touch with any questions or feedback, comments. We love to hear from you. The other thing, we will also be sharing a link to a survey at the end of this webinar. And it's not only a chance to let us know what you thought about the webinar, but also to share some ideas for the future, or share any feedback, or get in touch with us, tell us you want to share your story, or spread the word. So definitely take that survey. We love to hear your feedback. And thanks for being here. I will transfer things back over to Erica.
Maddie, I appreciate that. All righty, if everyone could bear with me here for a sec. Alrighty, now we're going to move into our panel section, which is going to start with our moderator introduction. So I have the great pleasure to introduce our moderator today, Dr. Irvga Kainak. Dr. Kainak is an assistant professor of psychology at Penn State Harrisburg and is a co-investigator on the Life Unites Us campaign. Dr. Kainak began her career with NIDA's Clinical Trials Network, where she implemented evidence-based studies in substance use treatment clinics in the city of Philadelphia. From there, she joined the nonprofit Philadelphia Safe and Sound, where she served under-resourced communities in collaboration with law enforcement, schools, treatment facilities, advocacy groups, and government agencies. She also worked at the Parents Translational Research Center at the Treatment Research Institute, where she researched the needs of parents of adolescents struggling with substance use and developed tools and resources to address those needs. Dr. Kainak, take it away.
Thank you, Erica, and thank you all for investing your time with us today. As Erica said, my name is Irvga Kainak, and I'm really pleased to be serving as the moderator for this panel of experts. Our purpose today is for our panelists to share their expertise on recovery and treatment during the holidays, especially this year when we have the added stress of a pandemic. I'm going to start by introducing all three of our panelists, and we'll then give each of them some time to provide an overview of their perspectives and any resources or services their organizations are providing to address the unique circumstances of this holiday season. And then following that, we will have some time for questions and answers. So let me start by introducing our panelists. Our first panelist is Steve Barnes. Steve has accumulated a vast amount of knowledge and experience, having been in active recovery for over 18 years. During that time, he worked for 5 years in the recovery field, performing inpatient services. And for the last 13 years, Steve has been following his passion as the director of JFT Recovery and Veteran Support Services. Welcome, Steve.
Thank you.
Our second panelist is Cheryl Dondero. Cheryl is currently the Special Assistant of Government Relations and Advocacy for Cadencia, where she is responsible for creating and maintaining effective and collaborative relationships with Cadencia's regulatory agencies, provider associations, funders, and referral sources. Cheryl has had a long and impressive career in the field. Prior to her work with Cadencia, Cheryl served as the CEO for the National Alliance for Model State Drug Laws. She was the director of Dauphin County Drug and Alcohol Services. And of course, she served as the Deputy Secretary of the Commonwealth's Department of Drug and Alcohol Programs. Cheryl has been very vocal about her own recovery journey from substance use disorder and continues to serve the recovery community as a certified recovery specialist. She received her Master of Human Services from Lincoln University in 2002. Welcome, Cheryl.
Thank you.
And last but not least is Nitara Iannacone. Nitara is the Assistant Administrator for the Dauphin County Department of Drug and Alcohol Services. Her job there is to oversee the county's efforts in substance use prevention, case management, and recovery support. Nitara is also a licensed professional counselor and works as an independent contractor for a mental health private practice, where she specializes in substance use counseling and co-occurring disorders. Nitara has been working in the field for over 10 years and is passionate about helping people affected by substance use disorder. She truly values working with individuals, families, and supporting agencies to provide access to treatment and recovery services to all who are interested. Welcome, Nitara.
Thank you.
So now we'd like to hear more about your work. So Steve, let's start with you. Can you take maybe 5 minutes to talk about your perspectives and outlook and anything your organization is currently doing to address the unique challenges of this holiday season?
Sure. And again, thanks a lot for having me here. Those who aren't familiar with JFT, just for today, Recovering Veteran Services, we do have a center in Illinois, combines housing, along recovery housing, along with a center that is here 7 days a week, basically noon until 11 o'clock at night, which is fits into what we're talking about with the holidays or any time that somebody in recovery doesn't have to be alone. They have a place to come to. We do a variety of other services here. Just real quickly, we are involved with the Cumberland County and Dauphin County warrant handoff. We have a veterans wing that we deal with veterans and the veterans food, PTSD, and obviously substance abuse, falls into that, what we do here. We also offer a clothing closet and a food pantry. It's here 7 days a week as long as we're open for those that need, and especially this time of year. Every time of year we're here. And we have just a variety of other groups and support groups. 7 days a week we have a variety of different types of support groups, recovery and or veteran related, that meet here at the center. They're their own groups, but they meet here to give a variety, to the recovery community. And again, the most important thing that we do is our little coffee shop that we have that's here again 7 days a week. Again, that you don't have to sit by yourself or be by yourself. So yeah, and this time of year, that's really important as far as that goes. You see a lot of it. What we do as far as the holidays here, and to try to help with that is, again, we're here, we're open. We do throughout the holidays a Thanksgiving dinner that we're here. Anybody can come to. Bring your family if you like. Come on your own. We do Christmas Eve where everybody gets a little gift by at the end of the day, and food, and it's the place to be. And then New Year's Eve is usually our big event. That's a safe environment to bring in the new year, and at the center here. So it's real important. The holidays can be very tough. They can be very good for somebody, and that can be bad too. So we sort of look at it as a workplace that's here, that you can just keep your feet on the ground through that time, through that period. Again, with the ups, the downs, the emotional ups and downs that come along with the holidays, the extra time that might be on your hands if you're not at work, you're not at school or something like that. Just a place to, you can keep centered, and come to. So.
Thanks, Steve. It's great to hear about all the resources that you offer during the holidays. I will mention your audio is a little bit difficult to hear. There might be a little bit of interference. I'm not sure if it's your microphone or if there's anything you can do, but we had a
Okay,
little
well,
interference when you were speaking. It got better at the end.
okay.
So next up, Cheryl.
I thank you. First off, to say I'm honored to be on this panel with Natar and Steve. We've been running in the same circles for quite a while now, and if we were still having face-to-face events, we'd be at the same place all the time. And you know, just so I'm really proud to be on a panel. Natara, I just love watching you grow up in this field, and I look forward to many more successes for you in the future. So, you know, I was sitting here thinking about the holidays, and what I first thought about was my last long-term treatment episode. I went in September and completed in February. And during that time, I had a very big birthday in November, me and my 30th birthday. And I remember sitting, I'm 30 years old. I just got fired from my job. I've lost almost every good relationship that I have. My family was still supporting me. So I went through, you know, Thanksgiving, Christmas, New Year's, you know, all of those holidays in my last treatment. And that was some time ago. I also was thinking about when I was at DDAP, that was just 7 and 8 years ago. And there was not probably a chance in, you know what, of getting access to treatment, getting into treatment from Friday at 4 till Monday morning on any holiday in between. It was a very different world. We were still in that kind of Monday through Friday business hours way that we got people into treatment from the referral sources. Now, not so much the community organizations, they would certainly have options for people, but you know, being at DDAP and in the single county authorities like Natara was in, the 24/7 model of being accessible to the community to access treatment was kind of just being born back, you know, 5 to 7 years ago. So working in a treatment provider now, and I am not a clinician and I don't actually work in a program, but I am very, very familiar with programs, both from attending many of them on my own as I was seeking recovery. And then I'm also very familiar with ours. And, you know, one of the things that I think happens, and Steve mentioned it earlier, sometimes people are missing what they perceive as their holiday traditions when they're in treatment during major holidays, and others are going, thank God I'm not with my crazy family over Christmas. So you have that mix. So you really have to be able to, and this will be guided by the clinicians, knowing the treatment plan of each person that's in the program, and this generally I'm talking about residential, is how to safely celebrate. And I think one of the things that's been around for a long time and continues to be around is, rather than focus on what you might be missing being in a treatment program during the holidays, the programs really look for opportunities for the community in the treatment program to serve others, whether, you know, they might be in a stage of treatment that allows them to go out, and they might go out and wrap toys for tots. So they might do something. I remember when I was in the halfway house in Lancaster, one of the things that we did, because Vantage House, Gadenzia's Women in Treatment program, was just down the street, we got to throw a party for the kids. And that was, so it kind of takes you out of yourself to give to others. I think traditions and meals and celebratory things that are turned from what you would normally be doing into a component of a treatment program are also very popular and good things to do in a program if you're in the program over the holidays. So, you know, making ornaments with a recovery theme, you know, doing things that, you know, Christmas caroling might be a thing. And then we're in COVID, and that even makes it more and more difficult because we can't go out, we can't interact with other people. So starting to take those things and figure out how we're going to do them in a socially responsible, socially distant, whether it's Zoom or you know, online, or, you know, so it's a whole different world in trying to take all of those things that normally exist and how we keep people healthy and engaged in a treatment setting through the holidays now even is even more difficult. But I really think meals are a big component of it. So I know in our programs, we never miss the traditional. When I say traditional, we don't just think about the one menu that most of us think of traditional for any holiday. We go all out in terms of various cultures and using the ideas of people, like, what do you normally have in the holidays? It's not always turkey and stuffing for Thanksgiving. It's not always the same thing for Christmas dinner. So I'll stop there. And, it's just, and I think the other thing that's challenging, and maybe we'll talk about it later, is one of the things that I know from the campaign, Life Unites Us, how do we be inclusive of so many different minority and underrepresented groups of many different cultures that celebrate holidays very differently, the many different holidays that exist across the spectrum of what we call the holiday season, and how do we be inclusive of all of those in a treatment setting? Something I think we can also discuss.
Thank you, Cheryl. And that's a great point about inclusivity, and also the point you made about the dichotomy for some people who, some of them are missing traditions, missing family, and others are kind of happy for the break, depending on where they're coming from. And then finally, Natara.
Thank you. So Cheryl used to be my old boss, so I owe her a lot. And she really made a difference in Dauphin County and in our office. So what our office does as a single county authority is that we oversee funding initiatives and just the standards and regulations that are coming down from the state. We provide prevention, intervention, case management, and recovery support services. So we like to help individuals, we almost call it womb to tomb. So everything from, a mother with, pregnant mother with a baby to those in the nursing homes. We like to hit them before they have any sort of substance abuse problems, right before, during, and after. So we really like to span the whole continuum of services. We are a funder of treatment, but we are not a provider of treatment. And I think a lot of times people get confused by that. We don't actually provide treatment services. The biggest thing we're probably known for is doing screening and assessments and referring to treatment. So we work with all of our county partners, CYS, all of our criminal justice, probation, the attorneys. We work with hospitals. We work with individuals on the street, our mental health partners. And, anytime that somebody's identified to having a possible substance use disorder, we are contacted and we step in to try to do an evaluation, see what, if any, level of care that they would need, try to get them into treatment, and then try to follow up with them to help them stay in treatment, and then continue services when they're out of treatment. So our job is that case management piece that kind of follows along with them. During COVID, it's definitely been different. Our doors have been open since July, so we are trying to be as normal as we can during this time period, where individuals are still free to walk into our office and ask for services. We also are able to provide services by phone and through almost like a telehealth video connection, which is very new for us. And that's something that the state has allowed us to do by allowing us to have verbal consents of information. So we are still able to get people into treatment, follow up on their treatment, even if we don't get to see them face to face like we would want to. So we're 24/7. So, you call us during the day, you get us. If you call us after 4:30, you actually get Steve and his folks over at Just for Today. But like what Cheryl said, there's so many changes over the last year of like how we look at treatment. Where now, if you call at 4:31, somebody will answer your phone call, and we will help you get into services. Back when I started with the county, which was 7-8 years ago, you got like one shot per year. Like you can go to detox one time, you could go to inpatient one time, and if you didn't stay, that's on you. You're not going back. And we have really changed as a system to really work with people who are, invested in getting services, who are thinking about getting services, trying to really meet them where they're at. And not everybody's going to get it, that first, second, third time. We have also worked really hard with our criminal justice partners to really, they're at the point where they do not want to incarcerate individuals if they don't have to. We are really working on diversion and not locking up people who have significant mental illness or substance abuse just because they have mental illness or substance abuse. So our office does a lot of work to try to get people out of the, jail system and try to divert them from ever going into the jail system. We provide case management CRSs, so that's a big thing that we have seen over the holidays is that, there's that need that people tend to isolate. We find that people, our recovery people are very isolated. So we have a certified recovery specialist who tries to work with our people as much as she can, and just kind of being with them, whether it's phone call or, going to a meeting, just trying to help them not feel so isolated or alone during this time. We do homeless outreach. So we find that a lot of people are, without a home for the holidays. So every week we work with our county partners to go meet them where they're at. So we're under the bridges, we are, on the streets, just talking to people and seeing how we can help them through this time. We also are working with various partners to provide holistic virtual groups. So starting more, not necessarily AA or NA, but like more community support groups that people can access online. So for those that don't feel comfortable, being face-to-face with others, they can still find connections in the recovery community. And I think that's all I got for now.
Thank you so much, Natara. And it's really great to hear that you are able to offer some continuity of care during COVID, which I'm sure has not been easy on your part, but sounds like you guys are doing really great work. So next up, we are going to move into the question portion of the panel. So I'm going to start by posing a few holiday-related questions, and any panelist can feel free to answer. Audience members, at this time, you can use that Q&A box to pose any questions that you might have. And again, we do ask you to use the Q&A rather than the chat function so we can keep track of everything. And my colleagues, Weston and Chris, are going to be helping to assist the management of the Q&A so we don't miss anyone's questions. So let's get started. So I'm going to start broad. What are some common misconceptions that people might have about treatment and recovery during the holidays? And again, any panelists, please feel free to speak up.
I can start. It's Cheryl kind of mentioned that. I think what I see is that people feel like they can't go to treatment during the holidays. They want to wait. Like, I can't go now, it's Christmas, I need to go the first of the year. So we should really struggle to get people to want to go during the holidays. And I think that's a very big misconception that they need to wait, where instead of just kind of being present with today and knowing that if they wait, it might be too late if they continue to wait.
I totally agree with Natara there. And I think, people, whether you might want to say, call it a last hurrah, like, okay, I can't go, I don't want to, because we still are in this kind of self-important mode that if I take myself out of my family unit during the holidays, my family will be devastated, when in not quite reality, your family is like, we wish you would go now. So I think that I totally agree with Natara that that's a misconception. I also think it's a misconception that it's hard to get into treatment during the holidays. But I think if you ask a lot of people with some stable recovery, when they think back on their, if you still use that word bottom, or think about the things in that you experienced in your addiction that really got you to treatment, you'll find some holiday related themes in there, because holidays can bring out the very, very worst in addiction because of all of the celebratory. It can also bring out the worst because holidays make it very ripe for families to, that dysfunction that already exists, to exacerbate over the holidays. So I think that is a big misconception. And I also think that it's a misconception that you totally miss all aspects of the holidays if you're in treatment, things that I mentioned before. I know a lot of people that were in treatment over the holidays who say they were their best, that was their best Christmas ever, because it got them to have their first Christmas not using, even if it was very early in their recovery.
I agree with everybody else there, and the conception whether you can even get to treatment during the holidays is out there also. But yeah, I agree that just let me wait through the holidays. I'll start after the holidays and all that. I got children, I got family, I got this. Like Cheryl said, this sometimes, please go, and then it'll be the best thing for you. Yeah.
Mm-hmm.
That's a great point. And do any of you find that COVID has kind of compounded this, where there are people who already are kind of feeling like they don't want to commit to treatment right now because of the pandemic, but then also the holidays coming up? And if so, what do you do to try to kind of get people past this misconception that they can't get into treatment?
So I was thinking of the year of COVID that we've, we're coming up on a year this winter, and because the first big wave was in the winter when there are no holidays. I think the first holiday that you associate with the pandemic and the restrictions cutting into people's lives was Memorial Day. So we had, March. Easter's not generally, I think, one of the big ones. And the other thing that COVID did in the winter across the provider network is that we went from, if we talk about 85 to 87% occupancy in a treatment program as break-even point, meaning that you can get by and you will be able to financially be sustainable if your residential and outpatient slots are filled at about 85%. Well, in a matter of weeks, most all treatment providers dropped from that mid 80s to under 50 in days. Like, it just, people left, nobody else was coming in. Criminal justice kind of shut down. So all of those entry points for people in diversion and deflection programs stopped. And now what we're seeing, even though we're not back there yet, amongst the provider groups that I talk to all the time in our associations, we're back up in the, maybe 70%, and it keeps inching up. So I'm almost grateful that we didn't have, the first wave of the pandemic didn't start in the fall and go through the holidays. I see us inching up through the holidays in spite of COVID. It seems like we figured out how to provide successful access to treatment and to provide services during COVID. So we're getting good at it. It's not people, because we aren't willing to experience another shutdown of all of those things, that people have, we figured out how to live our lives in the pandemic, and that includes treatment. So I'm not as worried about us having a big drop over the holidays, but I do expect that, as usual, we'll see an uptick in January, like everything. Like, if gyms were open, everyone's running back to the gym, or people have gone through the holidays, and now, like Natara was talking about earlier, I made this commitment that I will do it after the holidays. Or the holidays have caused such a rift with your employment that you now have employer, if not support, employer mandate for you to take care of, to get to treatment, or you may lose your job. So I think we figured it out going into this holiday season, and that, most of us see the inching up of getting back to financially viable levels of occupancy in our treatment programs as better. Now that comes, I want to clarify that comes with most providers. Gaudenzia, who has never shut down a program ever in 50 years, across 3 states, we shut down 12 programs. So we've kind of used COVID to right size as well. Like, how many programs can we sustain because it's taught us that we have to have this kind of, the possibility of a COVID-like situation is part of our financial risk management too. So getting back to the census has come with a big change in a lot of treatment providers have shut down programs that they could not afford to keep going during the height of the spring pandemic.
And also, I think the person has that fear of COVID, just the fear of it. And we in recovery make mountains out of molehills sometimes too, so that just amplifies it. But we found, people afraid of the COVID to come to meetings, get to treatment, get to whatever it might be, and to have a conversation with them that, their disease also can kill them, and to work through those things, just the fear, the outright of the COVID itself, to be willing to step out, and get the help they need. And that's been a stumbling block we've seen and worked through.
That's a really
I
good
think
Sorry,
kind of like adding on to what Cheryl was saying. when COVID first hit, it was very scary, at least for us, because like probation shut down. Probation wasn't doing house visits. The courts closed. Nobody was drug testing. So there was just this lack of accountability out there now for all these, people who were maybe doing well. And so, we kind of been just kind of sitting and waiting for like this big influx. I would say we haven't really seen it, like this big surge come, but I would agree it's usually after the holidays. So COVID or non-COVID, people want to start the year off, on the right foot. So we usually get our big surge then, and that's kind of what we think is going to happen now as well.
Thank you. So can you, let's move on to our next question. Can you share any tips in your experiences for protecting sobriety during the holidays and preventing relapse?
My experience just personally, and then working in the field, is just keep contact with people in recovery, in your situations, is going home to families, and sometimes that can be dangerous. I mean, my family, God bless them, they love me and all that, but they were offering me glasses of wine and stuff like that when I came out of treatment, and not to hurt me, but it was there. Just, I needed to keep touch with those in recovery, or counselors, or whatever, mentors, CRSs, whoever it might be, to just keep in touch and have that to deal with the highs, the lows that come with it, the emotional, like I said earlier. It can be really exciting and be home, clean, sober, in recovery, and then, you can forget what you're doing, or the depression part of it, being alone. That's the other one. If you're alone during there, you don't have a family to go to. So big thing I say for me, and then others I thought, just stay plugged in then with people that you don't have to be alone through this time.
Again, going back to my early recovery, and how to always having somebody either with me or on speed dial. Back then, though, they didn't even have cell phones, so I'm just standing by. But so that if you have, because my personality was one that I would put myself in risky situations before I would do something that I would perceive as being inhospitable or rude to a host, like leaving early. Like, it took me a long time to be comfortable enough with putting myself first that I put myself in risky situations. I was blessed in that most of the time my actual birth family and extended family was full of support. So I didn't have those worries about dinner at mom's. That was a safe place for me to be with, my parents and sisters and brothers and nieces and nephews and all of that. But I know having Steve's place now reminds me of some of the clubhouses that I had, in the 80s and 90s, that, okay, after you do your family thing, and then you could go have something with, with a very sober theme, and where everybody is in recovery. I think, again, the things that grew out of the last couple of decades, like dances that were, you could go to have a dance and it was a recovery dance. You could go to a holiday specific kind of gathering where it was all people in recovery. Whether you had if you came out of AANA and you had a sponsor, but today, and I would say that, the younger generation, some of my young friends are on this call right now, and they had that figured out long before we boomers did, about how to be connected and be able to, I've had it happen to me now, like some people in recovery, and you'll actually get a text saying, hey, I'm at this thing, I just needed someone to say hi to, and you have that kind of immediate access to safety, a safety net, and can get advice from somebody about, maybe I need to leave. Even I watch come out of the SCAs and come out of DDAP, years ago, there was only 2 reasons that you didn't drink at a party. You were coming out of treatment, or you were pregnant. So if you were a guy, you really had one option. And this really recovery friendly advice about not only for the people in early recovery and seeking to stay in it, but for people who aren't in recovery, who want to support people in recovery. Like, don't ask people why they don't drink. Just if they say, I don't want to drink, say, okay, we have soda. You know, I just saw that come out. I'm sitting here, I have my, national news on mute, and I've seen 3 different advertisements for our Get Help Now, our state Pennsylvania Get Help Now hotline. So there are ways that we're inundated with messages about it's okay to be where you are. And if you want help, we're here, no matter if it's Christmas Eve or whatever day it is, that we can help you get into treatment. We even provide transportation on all of those holidays. So we built the 24/7, Monday through Friday, every holiday included, not only into being able to have somebody drive you to treatment, but to being able to have somebody pick you up and get you there. So we've built that into our staffing. It's no longer acceptable that we don't have anybody on staff who can do that today because it's Christmas Eve or it's New Year's Eve or it's 6 o'clock on a Friday night before a holiday weekend. So that excuse is no longer, I almost would say if you have run into that in a treatment provider, find another provider. It just shouldn't be the case right now. Those are actually the days we should be hyper staffed and hyper vigilant to be able to get people where they need to be.
Thank you. I want to make sure that we get to some of the Q&A questions. Our third question that we wanted to pose was about, how things have kind of changed in terms of engaging in recovery and treatment during the holidays due to COVID. And actually, we have a question about virtual meetings, and that was something that was mentioned earlier. And I'm wondering, I'm assuming that you're kind of utilizing virtual meetings more during COVID. And one of our attendees would like to know whether you found them to be effective or not.
I'll jump in real quick. Yeah, the experience I've seen and heard from people with the virtual meetings, excuse me, I mean, JFT's been open, there's been meetings here, but the virtual, like anything else, some it works real well with and some it doesn't. It just, it depends on the individual, where they're at, and they're great. Don't get me wrong, any opportunity, any, way to get with people during this time is good. But our experience has been with the virtual meetings at the start, there were a lot of, we always had some pickup meetings here. People just had nowhere to go. It may have started with 5, 6, 7 people. That grew as the virtual component just wasn't giving them that, that personal touch they needed. So I've seen good from both, but I've noticed that as time went on, people crave more, to be with other people, some. So I've seen good with it.
I think they're great for people who have transportation issues, people who have, medical issues that can't make it. We do virtual meetings for our population in the jail and the hospitals that we're not able to come see. But you'll lose something, especially like for, when we're doing level of care assessments, that initial contact is so crucial for us to get them into treatment and then follow them. Like, you really create that bond face to face in the same room. And so it's so nice to be able to still help people right now, but we miss that. We miss that face to face connection that happens.
I think early on in COVID, and this was just not in a recovery setting with virtual meetings, but there were a lot of lesson learned on the, almost 24-hour transition to Zoom and GoToMeeting. And there were some very big stories about virtual 12-step meetings being hacked and confidentiality broken, and it put fear in people of, if I'm going to join this virtual meeting. And then you saw all of the big providers of these online services going towards the password protected, where a meeting organizer has to recognize and allow you into the meeting. So, but I think that those initial problems spooked people in a way to just join maybe a big group meeting where they didn't know. And then I saw it go to more people who already knew each other. So we all sort of had to learn or become a little bit expert in this virtual world. And then I found that people moved more towards a group of women. I'll just use an example of a group of women that regularly attend a women's group where someone would take the lead of setting it up for a group of trusted people that they knew. And then that felt a little bit safer than a meeting that could just be anybody logging on. In the treatment world, as soon as we were able, meaning it was no longer prohibited, because there's a lot of people in, you say, in an outpatient setting where telehealth, it's great to have it as an option, but it's certainly not the preferred option. And we heard that a lot from criminal justice for the reasons that were mentioned earlier. You can't get a urine screen in a telehealth setting. You can't see the eyes. You can't gauge withdrawal symptoms or behavior that you might be able to see easily in a face-to-face setting, or everything from how somebody is acting to how their eyes appear to an odor. You don't get any of that in a telehealth setting, and it's much easier to be less accountable in a virtual setting for people with the highest needs. I think it's great to have it as an option. And someone mentioned earlier, if you still have, good employment and recovery supports around you, and you maybe were in a stage of your treatment where you were kind of on the way to being completed, but it's not the best setting to initialize and engage and build a relationship with somebody on the front end of treatment.
As we said, on our, excuse me, the opioid epidemic started, the best thing to do was just any way we could keep people involved in the recovery process. Any way was good to have them there. And again, now we come into the pandemic along with the epidemic. Again, so any way we can keep people connected and holding on and not just be isolated out there. Yeah, it's been good.
Yeah, it does feel like it's been a great tool in some ways, but of course, it doesn't replace that kind of in-person contact that you get when you're in a group setting. So there is a question about family members and caregivers. So can you share any services that might be available for family members over the holidays as they learn to also manage kind of the sadness of a loved one in treatment during that time?
Yeah, I can start there. I think it's from a treatment provider perspective, is that it's something that we all strive to be able to do well, but I would say we don't do it well in a lot of cases. So, and then you add COVID on top of that, and we weren't able. So those family, if you're in a long-term treatment setting, or even let's say a month, you would start probably by the second week having Sunday family days where the family could come into the program. They would be usually required, in order to be able to do that, to attend some sort of educational setting about substance use disorder or what their loved one is experiencing in treatment. So, and those kind of stopped like very quickly. Again, what I mentioned earlier, when they just shut down. Families weren't coming in. Those family educational events were not seen as we're just initially learning how to manage COVID. They were not seen as the priority. I think that I've seen more of family members and loved ones having to figure out how to support each other themselves in the community. And I know Steve offers some of those kinds of events where it's, families can gather. I think these community groups are starting up where families who have maybe lost loved ones in the opioid epidemic or through overdose have used their loss to have a mission to help connect other families who are going through this. So I wish I could say I thought a lot of treatment providers did that well. I think if you ask them, they all say we do have those services available, but it has not. COVID has really impacted that probably in a bigger way than it has treatment in general, and that it's not something that I think most families who have had a loved one in treatment would say that treatment providers do really, really well.
Yeah, I would say just outreach the best you can. Like Cheryl said, we're getting more services that way and realizing that the family's impacted just as much and really doesn't know where to turn. We have the certified family recovery specialists, that are being trained and now that can be utilized for that to work with families struggling, through those times, share their experiences. And the other groups that are out there, like Al-Anon, Nar-Anon, have family members, but yeah, it's a lost time, and they just don't know where to go. So, but reach out and use whatever resources you can out there. And again, I think that certified family recovery specialist is a good thing that could help fill some of that gap too. So yeah.
Thank you. We're coming close to the end of our time, but I think we have time for one more question. So one of the attendees is questioning whether you all think that there might be a different paradigm this winter as compared to the usual rush for treatment beds in the past due to COVID. With COVID rates being so high, do you think that this might kind of result in a reduction of the number of patients that you're treating?
I would think yes, not necessarily on purpose. We're experiencing, like Cheryl says, we'll get like little exposures at different facilities, and then that facility has to shut down for 2 weeks. So we had this big, handful of beds available, and now they're not. And without COVID, I would say generally there are more people looking for beds than there are beds on any given day. We can always get them in, quickly, but maybe not that day. And I think this is kind of helping to slow things down because maybe there's not as many providers that have as many open beds as they normally would.
Yeah, I agree, Tara, and Alan, thanks for that question. So there's a couple components to that or aspects to that, I think, from a treatment provider perspective. So we have already gotten to a new, like a COVID-based capacity that is different from pre-COVID capacity in the same facility with the same number of beds, because we have had to create isolation areas, quarantine areas, social distancing of beds, head to foot. And then at the same time, you have to deal with as they come. I'll give you an example. If we have a facility with a 14-bed withdrawal management detox area, and we have 2 nurses and one of them is exposed to COVID and is in quarantine, 7 of those beds just have to shut down because we can't staff them. And it happens just like that. We have to transfer people out. So the biggest area I think it affects is, withdrawal management. And right now, we have seen more funders and referral sources wanting to contract with more detox withdrawal management facilities outside of the normal geographic area that they would have because of just that. I now have SCAs in the West that want to contract with our Bucks County detox management because we have Gaudenzia, we're the largest provider. We have 5 detox facilities in Pennsylvania, around 14 to 16 beds each. And before an SCA like Dolphin might only, might just want to contract with those in a given geographic area, our Capital 5 region. But now I think there's much more openness to having the broadest array of service possibilities for clients, and people are more willing to travel as well. I also, there's an aspect of your question too I want to talk about. So I think it's starting in Gaudenzia, we've been calling it the bubble. So while COVID's been going on, people are isolating, people are suffering in silence. People might have resources due to COVID in terms of unemployment and stimulus that they wouldn't have. So that lets them kind of hang on a little bit longer financially. But we have seen for the first time since we've started to have success around the opioid epidemic and reducing overdose deaths, they have increased almost everywhere. In 2020, and that we started to see that back in the summer, that we've had more than half the number of overdose deaths from January to June 2020 than we did from January to June 2019. So it told us that all of the progress that we'd made in the opioid epidemic and reducing overdose deaths with naloxone availability and more people being educated about it, we were starting to lose that momentum that was giving us success, and it's continuing.
Mm.
So at some point, and I don't know when that's going to be, and it's probably at some point as where vaccines are starting to get more out there and people where the restrictions are kind of moving back towards normal interaction, where it's going to burst. Like there will be a flood of need for treatment, and we don't know when it's going to come. But I think we all believe that it's definitely coming, and I think we're all going to have to work together, providers, referral sources, to make sure that we use our best data, from predictive, the way we can somehow predict that, knowing that we can't predict it at all. And we don't know what it's going to look like, but we're afraid because that COVID has reduced our capacities when we know there is going to be such a need, and we could be back like we were 7-8 years ago when there were just no beds available. People just couldn't get into treatment, and the need far outweighed the provider treatment slots.
Yeah, I think that we're definitely kind of still dealing with unprecedented times, and navigating this is something that none of us have ever had to do before. And I know that you're all working so hard to make sure that everybody has access to the services they need.
Can I just add something real quick to what Cheryl was saying, just to piggyback on both there. Yeah, we need to utilize all services that are out there, whether it's the treatment, whether it's the aftercare, whether it's places like mine, all that needs to come into place. Like Cheryl said, our epidemic, the overdose deaths have skyrocketed in some counties and raised, definitely going up. And we lost some of that traction, but I just think got to get creative and just use every service, everything out there. Even if they can't get the treatment, they maybe CRS can work with somebody, just something. And like Cheryl said, it's gonna blow up here soon for sure.
That's a great point. So we've had a really great discussion today, but unfortunately we are nearing the end of our time together. I want to thank the attendees who participated and asked questions to the panel. And of course, I want to thank our panel for their time and willingness to be a part of this webinar today. And I also just want to wish everybody a great holiday and New Year. And thank you so much for being here.
Thank you. Thank all the participants for your great questions. Yeah.
Thank you.
Thank you. And I'm going to just turn it back over to Erica to close out the webinar.
Probably be helpful if I unmuted myself. Thank you, Erica, and thanks to all of our panelists. You guys really did a fabulous job with this, and I know that all of our attendees really enjoyed listening, and myself included. It's always really great to hear your perspectives. So as we wrap up today, Maddie is going to drop the webinar survey in the chat box. If everyone could please click on that and just let us know, what you thought about the webinar, if you liked it, didn't like it, and what you'd like to see in the future. We really want to make these webinars tailored to what folks want to hear. So we really appreciate any candid feedback you want to share. I do just want to put a little plug in for next month's webinar. It'll be January 26th, and more information will be coming out about that probably later this month or once the new year hits. And, please be sure to follow the Life Unites Us campaign on all of the social networks. If you have any questions, there's an email address there. And I know Maddie also dropped her email in the chat box as well. I'll give everybody a minute to just click on that survey link. I'm sure Maddie dropped it, and I don't have the chat in. Yes. And it'll also be sent out with some follow-up minutes as well if you're not able to take it right now. But I just really want to thank everybody for attending, especially our panelists, our moderator, and all the attendees. We had, I think, one of the largest turnouts we've had so far. So thank you, everybody, for taking your time during the hectic holiday season. We appreciate you, and looking forward to chatting with everybody soon. I hope everybody has a healthy and happy holiday season. Take care.
Bye.